Using maths to make decisions about what treatments should be available in the NHS makes it sound very easy. Like many things in life, it's not that easy. In many circumstances, we don't know exactly how much a treatment costs or exactly how much health it gains. There are also disagreements between the mathematicians about the statistical tests that are used to compare different treatments. The other aspect we have to take into account is people's preferences about how money is spent on the NHS. The NHS is funded from a central tax, which means we have to take into account the public's views on how that money should be spent. How NICE does that is through the Citizens' Council, which are members of the public which advise NICE on the value judgments it makes about spending money and how it should be spent. Questions we give our Citizens' Council, for example, is you have two treatments, one used to treat a child with leukemia and one used for an elderly person with Alzheimer's disease. If you're a local NHS body and you only have £50,000 to spend, you have to decide how to spend that money. Should you preferentially treat the child with leukemia because they're at the beginning of their life and they have a whole life ahead of them, when it means you're actually not giving treatment to an Alzheimer's patient? Should you say, that person's had a good life, it's now time we look at the next generation? Or should you treat all patients equally?